So the main focus going forward is prevention rather than cure. Prevention is better than cure, and the things that we can do, as what the public wants to know is how can they reduce the risk of stroke by how their lifestyle, what they eat, and the way they exercise. And there's a big movement towards prevention. Um, and what they can do is one of the main thing is reducing the amount of saturated fat they um, they eat, and replacing it with monounsaturated and polyunsaturated fat. So that includes things like olive oil, avocado, nuts such as almonds, pecans, hazelnuts, and then an oily fish. Some people take fish oil supplements, but eating oily fish is a really good way of doing it. And the approach is called Mediterranean diet. And when you take a Mediterranean diet, as opposed to just a normal low fat diet, it reduces the risk of stroke and heart attacks. So cutting saturated fat is really important. And also nowadays we know that we should be cutting trans fats, which are all the things that make donuts and croissants look glistening and make them last forever on a shelf. So those are so trans fats is something that is also really important to cut down because it raises your cholesterol and raises the risk of stroke and heart attacks. And the third thing to cut down is it's ultra processed foods. So ultra processed food is things which don't really look like foods anymore. So things which are, it's a lot of sweets and things in packets. So the more you eat, the higher the risk of stroke and heart attacks. Cutting those down is really important. And then so you eat more of the good stuff, vegetables, fruits, high fiber, whole grains, and then cut the amount of red meat, cut the amount of saturated fat, and eat more, have more oily fish and chicken as your protein source. Those will reduce your risk of having a stroke and heart attack.